I feel like we have a significant number of people who are miserable in their jobs, but stay in them because of healthcare. They're like, I don't have any other option. Like, what do I meant to do? There was a report that came out a couple years ago. There's like 4 million people would do something entrepreneurial, but are sticking with their jobs because of healthcare. I was like, man, that's un-American. And so I think they call it, the healthcare handcuffs or something like that. It's like they're handcuffed to their job because of healthcare, and it's not right.
Welcome to the Progressive Bitcoiner podcast, where we explore the intersection of Bitcoin and progressive issues. I'm your host, Mark Stefani. My guest today is Andy Schoonover. Andy is co-founder and CEO of CrowdHealth, a community-based means of paying for healthcare. CrowdHealth is one of those ideas that, much like Bitcoin, takes a couple touch points before realizing its potential. For me, it was hearing CrowdHealth's members' willingness to pay for others' medical bills and the support that they showed for people in their community. Of course, one of those communities is Bitcoin-focused. This was a fascinating conversation all the way through, and I hope you enjoy it. Thank you so much for tuning in. Enjoy this episode with Andy Schoonover. Well, Andy Schoonover, thank you so much for joining me on the Progressive Bitcoiner podcast. I'm delighted to have you.
Yeah, thanks for having me. Should be fun. Appreciate it.
Absolutely. It's having you on the show is admittedly a bit of a selfish desire because I'm not only interested in what you're doing at CrowdHealth, but obviously within the healthcare industry, it's a bit more of a personal interest than necessarily relating to the overall theme of the podcast. That being said, if there's anything that hangs over the head of center-left voters, it's healthcare.
Mm-hmm.
And what you're doing here at CrowdHealth certainly is exciting. And I told John the other day when I spoke to him a few weeks ago, your head of business development, that I don't get excited about healthcare startups very often. To me, a lot of them are fluff. And what you're doing got me excited for the first time in a long while. And so I'm happy to have you. I'm excited to get into it and hear how not only the Bitcoin community can help CrowdHealth, but it sounds like a lot of other communities out there will find benefit in what you're doing. So please tell us how CrowdHealth started. What was the impetus by which you said, I've got to do something about this whole insurance industry within the United States?
Yeah, first I'm just excited to be on your show. I love how this and Bitcoin specifically can span across multiple different kind of political backgrounds, whether it be clearly there's a libertarian influence within Bitcoin, met a lot of conservatives and a lot of progressives as well in kind of the Bitcoin community, and so it's kind of fun that this is something that we can all kind of rally around. There aren't a lot of those things nowadays where the media wants to wedge stick a wedge in between people. It's great to be on. So thanks again for having me. I started CrowdHealth, just kind of a little bit of a background. I've been in healthcare for a while, so almost 20 years. Had a company that I ran that was basically doing remote patient monitoring. So we were monitoring blood pressures and blood sugars and weights and things like that for folks with all kinds of chronic conditions out of their homes to keep them from going into the hospital. So it was primarily our average customer was like 82 or something like that. They had two or three comorbidities, and it was a bit of a mess. And I was like, man, how do we be proactive about this as opposed to reactive about this? How do we keep people from getting these chronic diseases as opposed to now reacting to people who have chronic diseases? And so I ran that company for about 7 years, sold it, and as such, I didn't have health insurance because most of people have get their health insurance through their employer, and my Cobra was ridiculously expensive. I think it was $2,000 a month or something like that. And I was like, man, I got to do something else. And so I went into healthcare.gov, got a plan. It was I think $1,200 a month, and for me, my wife, and my two girls. And I kind of joke, it was it worked until I had to use it. So my little one, who was one at the time, had recurring ear infections. And so we went to the ear, nose, and throat doctor, who said, hey, she's got a perforated eardrum. And so she's got to get that fixed. And so we went to the local hospital, got it fixed. It was a 15-minute procedure. I think my wife and my daughter were in the hospital for like 45 minutes total. It's like the quickest in and out of the hospital ever, right? Get the bill and it was $8,000. And I'm just like, wow, like this is incredible that, this can be an $8,000 bill, right? And I was like, hey, but this is what health insurance is for. Like, this is the whole point of health insurance. And so, little did I know, a couple of weeks later, I was going to get something in the mail from my health insurance provider that was like, this is medically unnecessary, and so we aren't going to pay it. And I went through like 2 rounds of this, resolution process that they have. And even though my ear, nose, and throat doctor delayed his vacation by a day to do this because she was so concerned about my daughter's long-term hearing, they still found it to be medically unnecessary. So I had to stroke an $8,000 check to the local hospital. And I was like, man, like something is wrong here. Something is wrong. And, I've been super fortunate. I could pay that, but like the vast majority of Americans, I don't know what the number is, but 95% of Americans probably don't have $8,000 in their bank account to pay that. And, as I did more research, what I found is like 250,000 families go bankrupt each year, even though they have health insurance as a result of a health event. So these are people that have health insurance, have a health event, they can't pay the deductible, or it gets declined. The health insurance plan declines it, and they go into bankruptcy. Like that is a broken system, And so I was like, man, we got to do something different about this. And so over kind of a 2-year period, I built some tools to allow my family to operate outside of health insurance, in a viable way. And that kind of culminated into Crowd Health, which we started the beginning of last year. So we've kind of almost 2 years into this, and it's just been super successful. So happy to talk more about like the details of how we do that. But that's I came about, so like a lot of these entrepreneurial like startups begin as a result of some kind of hardship where somebody's got to fix this. Like, let's give it a shot. So that's what we did.
So who's your team, that core team? Who are the people that you're bouncing this idea off of? And where did that idea come from? Was there a light bulb moment or some other model similar to Crowd Health that you eventually thought could be applied to medical payments?
Well, I kind of broke it down and into kind of 2 buckets. One is like, what about the little stuff? Like, how do I get the little stuff paid for? Like just the primary care visit, the OBGYN visit, those types of things. And that one was pretty easy because those aren't that expensive. If you actually go in and say, hey, I want to pay in cash, will you give me a discount? Those are super easy, right? And there's also these programs out there where you can see somebody virtually for even less expensive, and so there's a lot of services out there that are easy for the little stuff. It was the big stuff that I had questions about, like if I tore my ACL, like how would I pay that, viably? And so I actually started looking at some of these crowdfunding sites, like GoFundMe. It's like, okay, so GoFundMe does this, like how do they do this, right? And then the question is like, okay, they do really, really well when it's a big event that it tugs at the heart. There's an emotional component, but how do you do this for like an ACL tear? Then I started thinking about like, okay, other industries use like reputation scores and quality scores and things like that to determine who I do business with. And so I started kind of merging some of these ideas together, and I've got a quirky brain maybe. But it's like, what if I do a crowdfunding where I have a dedicated group of people that were willing to crowdfund events for each other, and they could do that voluntarily, just like, GoFundMe. But there is a record that basically says, hey, I've been super generous to people, or I have been a Scrooge to people, which then incentivizes people to be more generous and then enables a more efficient crowdfunding mechanism to allow these big bills to get paid. So I took the GoFundMe's of the world and said, is there a way that I could make this with a little bit more of a dedicated group as opposed to like throwing it out on Facebook and hoping people respond? So that's kind of the model that I used. And we've used that now in something like 12 or 1300 bills, and it's worked. It's worked really, really well for, everything from a $50 pediatric visit to I think $157,000, brain hemorrhage. So it's worked really well.
Well, I look forward to getting into the details
Yeah, sure.
of how that all works from the community side and the kind of the behavior element of it. But first, high level, tell us about crowd health specifically, and how it works for the customers.
Yeah, sure. So, again, I'm trying to build tools to allow people to operate outside of health insurance, and so this is not health insurance. We are, as I like to say, and I know this is a bit contrarian, we are delightfully uninsured. And so I have been delightfully uninsured for the last, I think it's been 2.5 years or so, and have been able to pay my bills through kind of some of the tools that we built. But the specifics of this is, instead of sending your money to, or the system now is, you send a health, your insurance premium to a health insurance company, right? They hold it in this big pool of capital. They invest this pool of capital. They get interest off it. They get revenue off of it. They take that money that's theirs. But that pool of capital, because of inflation, is the value of that is decreasing. So it's kind of a melting asset. And so what I was thinking about doing is like, hey, if when a Crowd Health member starts with us, we open up an account for them. They put money into an account. That account is theirs. So instead of sending it to an insurance plan, you put it in your own account. That account balance accumulates over time. And then when Mark has a health event, let's just say you break your arm, right? And it's $5,000. Then Mark will be, responsible for that first 500, and then Crowd Health will go and crowd fund that remaining 4,500. And so I'm going to go to 45 people, and I'm going to ask each one for $100 out of that they can use out of that account that they've set up. And if they say yes, then it goes from their account to Mark's account. And then once I get 45 people to say yes, then Mark has enough money to pay for his broken arm. And that allows Mark to pay for that broken arm in cash, which is really a key component to this, because doctors are willing to give 30, 40, 50, 60% discounts if you pay them in cash at the point of care, as opposed to them having to go through the expense of billing health insurance, which, if approved, they don't get the money for 60, 90, 120 days. So that's the key component that makes this significantly less expensive, is, docs are willing to negotiate if you pay them in cash.
And so each customer is paying, correct me if I'm wrong, $175 a month, and that goes into essentially your account that you can use to help pay other people's bills. And then if you have one, you incur that $500 up front. If assuming it's a bill greater than $500.
Correct.
Interesting. How often do customers get asked to pay a bill? Is it like every week, every month?
Yeah, it's about once a month.
Really?
I think right now we're averaging about once every 6 weeks.
Okay. And so you do this within a community, correct? So you have a Bitcoin community that's approximately 1,000 people, or that's the top level, and then you also have like a fitness community. Is that correct?
Yeah, we have kind of three communities. We have a kind of the legacy community, which is the ones that kind of started with Crowd Health and have been one of us since the beginning. We've got a Bitcoin community, which is just Bitcoiners, and we're now starting a fitness professional community where it'll be just fitness professionals. And so those people are all sharing within their communities, and the reason that we're doing this is because I do think there's a behavioral component of this where, if I have health insurance, and most of us, I think that we're getting kind of screwed by health insurance. And therefore, if I have a health event, I'm actually going to try to extract as much value out of that system as possible, right? Which kind of creates a death spiral for the insurance companies. They have to raise their rates big time, right? And so if I'm actually thinking about my community, like, I don't want to screw people in my community, right? Especially, if they're Bitcoiners, like, I don't want you to have to sell your Bitcoin. Like, I want our community to be a really healthy community. And so there's a behavioral component of this within the affinity group that I think is really, really, important. And I'll give you like a quick, perfect example. And this is actually from me, like I'm the CEO of Crowd Health. I should be acting in the best interest of the crowd. Right. And so I had to go get labs. So I went to my primary care doc who gave me an order for labs, right? It's just a normal part of your annual checkup is to get labs. So he gave me the order, and then I've got this place like a mile from my house where it's just like this walk up lab place where I could have gone. And so I priced it out and it was like something like $450 to get these labs. And I was like, you know what? Like, it's just so easy. Like, why don't I just do this? I was like, but you know what? I'm a member of Crowd Health. I don't want to screw the crowd. Like, let's just see what Crowd Health can do. So I sent my labs to my care advocate at Crowd Health, and she's like, "Oh well, there's a lab that's just one more mile down that can do it for $44. Same lab, a tenth of the price, for a mile, right? So I went another mile down the road and did it at another lab for $44, and I saved the community $400, right? Because I don't want to screw the community. If I was in health insurance, I just want to like, I'm just going to go to the easiest, like right down the street, like easy, but we need to start thinking about how much this stuff actually costs and behave in a way that is more community focused. And so I think this affinity group, and it still happens, right? Like we got bad actors in the community, like it's going to happen. It's impossible to keep everybody out, but I think there is a general sense of like, I don't want to screw my own community. And so it's kind of a cool thing about what we're doing.
I want you to describe some of the failures of the insurance industry that
Mm,
you believe are kind of the biggest players here in why you started Crowd Health. And you touched on one, and that's price transparency. I work in the hospital. I don't have any outpatient contact, and so I couldn't tell you what a cost is for a particular lab. I don't know if you came to ask me what a cash would be for paying for something, I wouldn't be able to tell you within
sure.
working in the hospital. But what I can tell you is that we have no idea what the cost of certain tests, imaging tests, procedures are. And so I can't tell a single patient what those costs are going to be. And in turn, the behavior for physicians in the inpatient setting is 9 times out of 10 going to be to default to ordering a test, ordering a lab, even if you have a question mark, the slightest question mark about whether or not you should be for a patient.
Hmm.
And there's a large discussion around if that's appropriate or not with regard to overall care. But nonetheless, that from a cost perspective, that most certainly drives it up. And
Yeah.
so I would certainly believe that if there was more transparency in there, not only would physicians be, you know, asking themselves, is this truly necessary? And in turn, probably looking into that answer more, looking up what is the evidence behind ordering this lab or this procedure in this setting, doing that more often, but the patient would probably be able to have a say in that. So
Sure.
getting back to my question, what are the failures that you really see in the insurance industry that is driving what you're doing?
Yeah. So let me touch on like what you just talked about for 1 second, because I think there's kind of two components of this. One is I think the doc should have the tools to ensure that their patients are well, right? Or the tools to assess to diagnose what the problem is. And I don't think there should be a limitation on what you can use. I think the problem comes with the cost of that lab or imaging or whatever ends up being. And unfortunately within the hospital system, the way that we're currently set up is if you get a lab or an imaging or whatever within the hospital system, it's usually 5 to 10x what it is outside the hospital system, right? And so if your lab or imaging was 10% of what it is, it's actually being charged at within the hospital system, then you can use those tools in a much more kind of liberal way to ensure that our patients, are safe. I'll give you one example. We got an ER bill from one of our patients, or one of our members, and it was just a comprehensive metabolic panel. and the cost was $285 for a comprehensive metabolic panel. And so a lot of people are like, "Oh, who cares? That doesn't sound like that big a deal." Just down the street, it's $5, right? So within an ER setting, they're upcharging that and it probably costs $2, right? Like to actually do.
Right.
And so within an ER setting, they're jacking up the price of that by 55 times. And in any other setting, that would be unacceptable. And so what we do for our members is we go back to the hospital and says, this is unacceptable. You are price gouging our member, and you need to adjust that. Like if you have a hurricane in Florida and everybody goes up I-95 to get out of the way of the hurricane, like it is illegal for these gas stations or these hotels or whatever to price gouge people in the case of an emergency. Yet if I have a healthcare emergency and I go into the ER, it's fair game for the hospital to charge basically whatever they want to charge, right? And so we are the members advocate to say, no, you can't price gouge people. You have to give us a fair price. And actually there's a law, it's UCC 2-305 that says, if there's no pre-negotiated price, you have to negotiate a fair price after the fact. So, the hospital, said it was $250. We went back to them with an attorney and we said, hey, listen, you can't charge $250. That's not a fair price. And so the hospital brought down that price significantly. I think it was down to like $7 or $10 or something like that. So that's just a problem within the system, that the consumers of healthcare are not actually the payers of healthcare, right? It's an insurance company that is supposed to be our agent to negotiate on our behalf, to allow us to access care. But that agent also has an incentive to actually see prices go up, not see prices go down. And so, your listeners might be like, wait, hold on a second. Like, that doesn't make any sense. Well, insurance companies actually make more money if you're sick than if you're healthy. It's a kind of a crazy thing. And there's a provision in Obamacare, 10 or 12 years ago, that's like insurance plans can only benefit 15 or profit 15% of premiums. So, and from the outside looking in, that looks like a great idea, right? Like, we don't want insurance plans to be making tons and tons of money on us. However, they can only make $150 on $1,000 premium, right? So how do they make $165? They have to raise their premiums from $1,000 to $1,100 a month. So they actually have an incentive for prices to go up because they can then make more money. And so that's the perverse incentives that we have in our healthcare system, that are just crazy town, to me. I mean, the other thing too is health insurance plans, you're supposed to be negotiating with doctors, are oftentimes the owner of that doctor. Like, so they are negotiating with themselves. So they're on both sides of the negotiating table. United Healthcare is the largest owner of doctors, the employer of doctors in our country, which is just crazy to me. So there's just so many perverse incentives within the system that, I think we need a new system.
Absolutely. And I think you've described on a different podcast an example, the private practice is a dying breed,
Yeah.
because the hospital systems are sucking up all these community-based hospitals as well as clinics into these huge health system conglomerates within Minnesota. Here we've got Mayo, among others, that are doing exactly that. How have you seen that play out with regard to pricing and insurance for the individual?
Yeah, the thing that is happening in the industry, it's not just what we're seeing. It's like, if you think about the negotiating leverage that United Healthcare. So I'll give you one example. We're in Austin. We have two big health systems here, Ascension and St. David's. So United comes in and says, "Hey, I want to negotiate with you." And Ascension and St. David's is like, "No, I'm not going to negotiate with you because you need me. You have to have me to have a presence in Austin, Texas. So I'm not going to negotiate." And so United doesn't have a whole lot of negotiating power. United comes into a single doc and says, "I'm going to negotiate with you." And that single doc may be like 30 or 40% of their patients are coming from United Healthcare. So United has an incredible amount of power to negotiate that down. So what the hospital systems are doing is saying, "Hey, doc, you're getting a really low, payment from United Healthcare. Let me buy your practice. I will roll you into the hospital system. And now, that same practice can jack up their rates because the hospital system has a way better, rate than the independent individual doctor. And so all the rates in the market go up as these hospital systems consolidate. Right. And so, that's what we're telling our members is like, look, call us if you're looking for a doc, because we want to give you to an independent doc that's not a part of the hospital system. Because if you're a part of the hospital system, you're going to pay way more for everything across the board, whether it be labs, imaging, primary care visits, whatever. And so we try to keep people into an independent doc. It's not always, an option, but we try to as much as we can.
And then you look at regulation, as you mentioned earlier, with Obamacare and limiting profits that the insurance companies can get. Like everything, the unintended consequences of that resulted in just them jacking up prices. Mm-hmm. And so I think your perspective, much like Bitcoin, is coming at it from, we'll change things from outside the system rather than trying to tweak these regulations that, quite frankly, there's always going to be a workaround, and 9 times out of 10, that workaround is going to result in increased costs for the end user, and in this case, the patients. In addition, I'm kind of curious to know, the history of insurance in the United States is a fascinating one, and it, having started basically to cover loss of wages, has now morphed into this behemoth of covering everything that you can think of under the sun. I just went through the enrollment process. They asked me, 20 different things that if I wanted to pay for to have insurance on, a variety of different coverage from legal to disability to, and it's just like, what the hell is all of this stuff? How did we get here? And moreover, do you feel the employer-based insurance coverage system that we have is affecting small business growth, given the overhead that they're having to deal with?
Yeah, the combining or coupling health insurance with employment, started back in, I think it was the 50s, and now has been kind of codified in law here over the last decade or decade and a half or so. And I think it's unnatural for our employer to be also our healthcare provider. I don't particularly want my employer to be in my health business, yet they are legally in our healthcare business. And I think that these employers, while they do have a incentive to reduce costs, it's not their core business. It's most of these companies are software companies or manufacturing companies or whatever, and so it's something where they tried to offload this onto insurance companies as, hey, you take care of it, I don't want to deal with it, I don't even want to think about it. And oftentimes they just get a rate increase, and they're like, whether if they're public, they go to their investors and they're like, there's nothing we can do. If you're private, you just moan and groan and bitch about it. And so, these employers just don't have a whole lot of energy to fight this, and therefore there's no hand, the invisible hand to push down these prices, because these employers just don't want to deal with it. And so I think it's a real problem. And in fact, it's so much. I believe it's so big of a problem that we don't do any employers. Like we firmly stand on the ground that your health insurance and your employment should be separate from each other. And so we actually have people that will go back to their employer and say, hey, listen, I know you're going to spend, $5,000 on me or whatever it is this year. It's more like 7 probably. So will you give me 5, as opposed to me, if I opt out, will you give me 5 so I can go and do whatever I want with my healthcare? And so there's a tax friction there because that's income. But we've had a really decent chunk of people actually do that. and now they get $5,000. We're $175 a month, so it's just, let's say, $2,000, right? And so there, is some tax friction there, and so they still come out, $1,000 ahead, by having, a better option for them, lower, deductibles, things like that. So we've been pretty successful in those people going to HR and doing that. So it's interesting. One other quick component of this is I feel like we have a significant number of people who are miserable in their jobs, but stay in them because of healthcare. They're like, I don't have any other option. Like, what do I meant to do? There was a report that came out a couple of years ago. There's like 4 million people would do something entrepreneurial, but are sticking with their jobs because of healthcare. I was like, man, that's un-American. And so I think they call it, the healthcare handcuffs or something like that. It's like they're handcuffed to their job because of healthcare, and it's not right.
Yeah, and I can imagine that their productivity at whatever job this is not ideal, right? So what's the drag on the company itself when you don't have somebody who's interested in performing, that they're there just for these insurance handcuffs?
Yeah, totally.
So much like Bitcoin, this leap from something that we are familiar with, stocks, bonds, real estate, et cetera, that we've grown up with for the past half century, in jumping to Bitcoin is a big leap. You are doing the same with something that is comfortable. I sign up for my Blue Cross Blue Shield plan, and that's that. You're asking me to do something completely different. That's really never been done before, and there's the fear in that, and in that unknown.
Sure.
I'm curious to know what you're doing as a company to help minimize that fear and minimize that transition for people to make that leap.
Yeah, I can't say that we've gotten it perfect. It's our number one barrier is people saying, it's like the devil I know versus the devil I don't, right? I know health insurance sucks, and so, but are you all like viable? Like, is this a viable way of paying for my health care? And the other thing is nobody wants to be like the first one. Like, like it's hard to be the first person in something brand new. So, thank you, the guy from Houston who was our first customer. And so, we have thousands of people now as a part of this. And so I'm trying to communicate two things. One is, you think your health insurance is riskless, but it's actually very risky from my perspective. Healthcare.gov, the Kaiser Family Foundation came out with something a couple months ago, and it said 18% or almost 1 in 5 claims are denied. So you have a 1 in 5 chance of getting an $8,000 claim, like I did, denied, and I had to pay it out of my pocket. And so that seems pretty risky to me, a 1 out of 5 chance. So that's one, is health insurance plans are very risky from my perspective. The second is why is Crowd Health able to do this at such a lower cost than health insurance? And we give out a bunch of data that says, like, look, this $250 lab that your health insurance plan paid for in the hospital, we got down to $10. This $22,000 ACL tear, we got down to $12,000. The $86,000 heart ablation in Wisconsin, we got down to $22,000. And so we give them, example after example of how the health insurance plan, because they don't pay attention to prices all that much, would pay this. We're paying this, right? And so we are being super effective in getting these prices down. And then there's kind of a third component, which is, our people who are joining us are actually really like self-selecting are healthy. Like, they're younger, they're less risk averse, right? So they're the younger ones tend to be less risk averse, and then they tend to be healthier. And so our average age of our customer is like 36. The BMI is somewhere between 4 and 5 points lower than the national average. And they're just a healthy population. And so when you're in an insurance, group, right, like, you got all kinds of stuff going on in there. In our group, we got a bunch of 30-year-olds who, yes, do have active injuries, who, yes, go down the Black Diamond ski slopes probably more often than the 80-year-old woman And so we have some of those things, but those active injuries are significantly less expensive than the the chronic conditions and or the cancers and illnesses and things like that you typically get with like the Medicare population and those folks who are older. So it's been hard. It's I kind of drug that explanation on, so I apologize for that. But I probably think that's an indicator like this is a hard thing to do. Like this is not easy to get people to change their behavior, especially around their health, which people think is so precious, especially when it's so expensive. Um, so it's one interesting point here is if healthcare wasn't so expensive, we wouldn't have the need for health insurance plans.
Right.
Right. Like if you think about that for a minute, right? Like health insurance plans want healthcare to be expensive because they are then needed. If it wasn't that expensive, they wouldn't be needed. And so, I just think that's kind of an interesting incentive for, health insurance. But yeah, it's a messaging thing that we're still trying to figure out, to be totally honest with you.
Well, as an historical side note, it's interesting the annual physical exam that's recommended, um, even though it's not recommended anymore because it's not found to be beneficial for people without chronic diseases, is actually more of a waste. But that actually started in the early part of the 20th century because the insurance companies realized that at the time, if they had people go into their doctor for an annual exam, at that time could help stave off chronic conditions, disease, and be treated in turn, which meant the person's going to live longer, which means they're going to be paying more premiums. So
Mm-hmm.
the annual physical exam came about because of that and has existed since then as a result of that. And eventually it got covered and paid. Initially, physicians were reluctant to do it because they weren't getting necessarily paid for it. But once that got wrapped into insurance coverage and insurance companies paying for it, then it became kind of this routine thing to do, even though now we found out that it's not actually as beneficial as we thought it was at one
Mm-hmm.
time.
Mm-hmm.
I think one of the big differentiators that you have at Crowd Health are these care advocates. Tell us more about how that works.
Yeah, I don't know about your insurance experiences, but mine have been frustrating because I try to call into, whoever my insurance provider is, and it changes every year, right? Like you just go to the cheapest one. And I call in, I talk to somebody on the phone, and I tell them my problems. And, in some of these cases, they're like, intimate health problems. And I'm talking to somebody I don't know who ends up transferring me to somebody else I don't know, where I have to tell them the same thing. And they don't figure it out 9 times out of 10. So I got to call back. It's just like, um, it is such a pain point. And so what I wanted to do, and this, costs more on our end, but we think it's worthwhile, is like have somebody internally who will advocate for you, who who they are because you've talked to them. So you're talking to the same person every single time that you call in. So instead of calling in and waiting online, what you do is you schedule a time with this person, a 15 or 30 or 45-minute chunk of time in advance. So you know that person's going to be there. You're going to be able to talk to them and they know who you are. And so, and if you have a health event, then you can call them and say, Jasmine, who's one of our care advocates, I was playing pickleball last night and I think I did something to my knee. Like, what should I do? And Jasmine says, oh man, we've got this great orthopedist in Austin. You should go see him, and, let us help you with that. And so, great. She doesn't have to do anything. And she goes to the orthopedist and the orthopedist says, yeah, it looks like you tore your ACL, right? It's, to call back Jasmine, I tore my ACL. Like, oh my gosh. And she's like, oh, I'm sorry. Like all these people are super empathetic, right? It's like, okay, well, let's find you an orthopedic surgeon to do this. And so we find them a really great orthopedic surgeon in Austin to do this at a really great rate because we're paying in cash. Our member is paying in cash. And so our care advocate can walk alongside you. And so you don't feel lonely in this super complex system that, even doctors don't understand all the time, right? Like I have no idea what to do next. And so we've got these people who are trained on this stuff that can walk you through so you don't feel like you're lost out in the middle of nowhere. And oftentimes, like I said, one of the most like kind of needy times of your life, right? Like I need somebody to help me walk through this because something is going on with me. And it's not this cold insurance company. It's like a person that you know that will empathize and will help you. So we think it's a great component. And we actually think it's so great that we require you to have a 15-minute conversation with our care advocate before you join, to get to know them and make sure that you're on board with this. And it also allows us to significantly lower cost, right? So if you go to whatever orthopedic surgeon in Austin, they could charge you whatever they want. And, there's no kind of limit on that. And if they go through us, then we actually know how to negotiate that beforehand and actually get a way better price than if you were to go and do it on your own. So that that care advocate allows us to kind of facilitate a really good price for our end users. So it's a really cool kind of part of the product, our product. And a lot of time you can text them if you want to, and if you text them, they'll get back to you as soon as they can, or you can call them, or there's a multiple different ways that you can get in contact. Because some people like to have the face-to-face video chat, and some people just like to text. And like I said, we have most people in our mid-30s. So it's a text-heavy type of group. And I'm in 43. I like to text. I text Jasmine, who's my care advocate, my doctor order a couple weeks ago, and she got me set up like that with a lab. It was just super easy. I didn't have to worry about it.
Before we get into the Bitcoin side of things, tell me what you think are the limitations to the crowd health model, and who may not be the ideal customer for you at this time.
So there's kind of two limitations that we put on people. If you are obese, then we don't allow you into the community. If you get down to a reasonable weight, then you can. So right, or starting January 1st, it's 260 if you're a male and 220 if you're a female. And if there are people that are like, have significant, like muscle mass, then we can make some exceptions around that. But that's generally what that is. And then, if you're a smoker, then you're not allowed into the community either. I mean, and ultimately what this is saying like, look, we want people who take care of themselves and take personal responsibility for their bodies. And if you smoke, your costs are twice as much as somebody who doesn't smoke. If you're obese, their costs are twice as much. And so those people just aren't good fits for us. And so those are a couple limitations that we have. If you have a condition of some kind, like a pre-existing condition, all we ask is you own your own pre-existing condition for a couple of years before the community will help you with that. So it doesn't work great for some of these chronic conditions, and we want to change that. Like we're trying to build an infrastructure right now that will allow us to in the next 12 to 18 months take on some of those chronic conditions. It's just right now we can't, because as you can imagine, like having 2,000 diabetics in our group like really doesn't go well with the way that we do things. But our vision is to bend the cost curve, and it is to take some of those folks on into our community. We just can't quite do it yet because we don't have the scale or the infrastructure to do it.
But I could imagine a time when crowd health has a large enough pool of these healthier individuals, whereby you're a much more viable startup at some point in the near future, that communities for individuals with, say, diabetes or being overweight and obese, you put that into a model such as crowd health, where you have this community engagement and shared responsibility for cost. And I bet you'd find that you would get better outcomes from those community members than they otherwise would get in the system that we're in now.
Oh, absolutely. And that's why I'm fired up about it. I'm fired up about taking some of these folks with type 2 diabetes and be like, I think you can cure this. I think you can cure your type 2 diabetes with the right, nutritional, component and things like that. And that's something I think crowd health will be able to do, in the near future to help people, with some of these chronic conditions really, improve their lives. I mean, look, I want people to thrive, and I'm candidly, I made a bunch of money in my last gig. Like I could be on the lake fishing, which is my passion. But like my I truly believe, like, I do this because it's missional for me, and I want to see these people thrive. Like, I want to see families not have to go into bankruptcy because of health insurance. I want to see these people who feel like they've been left out because they're, obese or have diabetes or whatever it ends up being, because they don't know what to do. Like, they don't know what to do next. And so my heart is for some of these people who just don't have the education, candidly, to go and take that next step, because they've been lost in this big insurance system that kind of actually incentivizes them to have diabetes or incentivizes them to be obese, and it's like, man, we can do better. We can do better than this. And I think these people just need to be a part of something bigger. I mean, don't we all want to be a part of something bigger, right? Like, that's just human nature. And if I can introduce them into something like, hey, be a part of something bigger where we can actually help you thrive, like, man, that's awesome. And I truly want to do that for some of these folks. And that's my heart, to do that for some of these folks. It's just, we need a little bit more time to build kind of the infrastructure to be able to do it.
Yeah, when you're stuck in a system that has zero advocacy and you move to uh, a community where there is, I think you can really see a lot of great things happen. And so your passion and drive for that is certainly palpable, and I commend you for doing it. I'm super excited for what you guys have going on. Let's get on to the Bitcoin before rounding things out
Sure.
here. How is Bitcoin incorporated into Crowd Health?
Yeah. So I built this system on kind of a fiat system, and then had a conversation with Jimmy Song, who I think many of your listeners who've been in the Bitcoin community know Jimmy. He lives here in Austin, and I was having lunch with him, and he's like, "Man, the problem with health insurance is, again, this kind of big pool of capital that's melting, as Michael Saylor calls it, right? Melting ice cube. So what if you had, Bitcoin as a component of this, where there's a bit more of a stable asset that is being in the background here, and then people can actually own that in a decentralized way. So instead of having it in one big pool, like, let people own their own account. We use Swan right now, so for every $100 you put into your account, $75 of that goes into your Swan account, and it gets held in Bitcoin. And then, if that Bitcoin goes up, what is it at, 18,000 or something like that today? It's hard with the volatility over the last couple of days to know exactly where it is. If it's 18 and it goes to 250, like most of us think it will, then you get all the upside of that. And so if you leave Crowd Health, you get all the Bitcoin that's in your Swan account, you get all the cash that's in your fiat account. Like, that's all of your money. You get all the upside of that. And look, if it goes down, you also have the responsibility of if I come and crowd fund something and it's $100 and you don't have $100 in your account, then you have a decision to make. Like, you can put more fiat into your account so that you can do that $100, or you can say no to the the crowdfunding event, which impacts your kind of reputation score within the community. And so you have a decision to make. And I think most Bitcoiners understand that that's just a reality, that it could go up a lot and it could go down a lot, and that's okay. But they love the fact that instead of sending it to a health insurance plan and it disappears, like, you're actually stacking sats while also helping to pay for healthcare. Like, that's a really cool component of this that I think the Bitcoiners really like. And I was just looking at stats this morning. It's like 2/3 of our members over the last week, I just kind of looked at it for the last week, are Bitcoiners. And so we have a big Bitcoin crew, that is, growing quickly. And so we're fired up about that. The other component of this is all the Bitcoiners, as we mentioned earlier, are in an affinity group. So they're sharing expenses with each other. And from my just, quick look at Bitcoiners, as I was in Bitcoin 22 in Miami, and maybe it was a Bitcoin conference, or maybe it was because it was Miami. I don't know. But, like, you're walking through the halls and it's like, these people are healthier than the general population. Like, there is an additional set of personal responsibility people take for their health. They are generally more healthy. And I'm seeing it in the stats. Like I'm saying, the BMI is much lower, those types of things. So it's just a cool community to be a part of. And I think that the incentives are more aligned to, if you're a part of, the Bitcoiners. So it's a cool component of what we're doing, I think.
Is it at all a part of the payments side of things, or is it more?
Not yet, but we're working on it. Yeah, we're working on it because I want to start paying docs in Bitcoin who want Bitcoin. Like, I'd love to be able to do that. And so we're actually working on the back end tech now to be able to allow people to do that. In that case, you can hold all of your money in Bitcoin. Right now, it's 75% Bitcoin, 25% fiat. If we can actually pay in Bitcoin, then we can just put it all 100% into Bitcoin. You can just pay in Bitcoin. And so we're working on that in the back end.
Nice.
One of the cool components of this, by the way, is you're in the hospital, so you may not, apply, but like a lot of these docs, right, have to bill through an EMR. And that EMR takes somewhere between 6 and 10%, depending on how big you are and volume and things like that. Like that is a wicked high transaction fee. If I can pay you, right now we're paying you in debit cards, or credit cards or whatever. And so it's like 1.5% to 2% transaction fee. If I could do that over Lightning, it becomes pennies, right? And so we can strip another couple percent out of the system by just using Lightning as our payment structure. And 2% doesn't sound like a lot, but take 2% of 4 trillion, which is our healthcare system bill. It's like that's a significant chunk of cash that we can rip out of the system by just the processing it in Lightning. The other thing too is like I want widespread adoption of Bitcoin. And this is the biggest industry in the United States. If we can figure out a way to use Bitcoin in payment for, a $4 trillion industry, I think that goes a long way of, in more people adopting Bitcoin, which is what I think most of us want.
Absolutely. That's fascinating. I like that. I had asked my employer a couple of years ago if I could get paid in a chunk of my salary in Bitcoin, and they just laughed at me.
They looked at you like you're a crazy person.
Yeah. Why would you want that? Why would you want that? Anyway, so I'm curious to know what other, aside from the fitness industry, what other communities are you hoping to branch into in the coming years?
Yeah. So, we got fitness, we got Bitcoin. We're looking at real estate agents, which is another one where it's anywhere where we have a density of 1099s. Or solopreneurs or gig workers or those types of folks where those are the folks that struggle with where to get healthcare. And so we think that's going to be a really great market. The other thing that we're looking at too is small employers who right now look at the healthcare system. It's like, man, I wish I could help my people with health insurance, but I can't because it's so expensive. And so we're going to them and say, hey, listen, you don't have to pay them. You don't have to get their health insurance. Like give them, a stipend or an increase in salary or something, and then let them go figure out what their health care looks like. And by the way, we're happy to present, Crowd Health as an option, which is, really low cost compared to the alternatives out there. So that's kind of the path. And then, we're 2 years in, so we're still, I still consider us a startup. We're still learning as to, where this message resonates. But interestingly, our biggest group of people right now, other than Bitcoiners, are healthcare professionals. Physicians and nurses. We ask when you sign up, like, what are you? Like, are you a business owner? Are you a real estate agent? Are you whatever? And one of them is a doctor/nurse. I don't know if it's doctors or nurses, but for some reason we have a really large component of docs. And a really quick story if I have time, but like we had this member in Tennessee, 19-year-old got her hand caught in the prop of a boat, severed 4 of her fingers, right? And this is a big expense, as you can probably imagine. So we crowdfunded it. And we had people, this is such a cool component of like our community. We had people when we said this, we was like 19-year-old Tennessee, she got her, fingers chopped off by, a boat. People were like, hey, I want to give her more. Like, can I help her more? And I'm like blown away by like these people who are like out of just generosity, right? Which is kind of a lost thing in our country. I feel like just like, I want to help this woman because I can't imagine. We had a miscarriage a few weeks ago. It's like the same thing. It's like, man, like what can we do to help this member of our community? And it's like, you would never see that in health insurance, right? Like health insurance has sucked the humanity out of healthcare. And so I'm like, man, if we can like bring back humanity to healthcare where you actually know where your dollars are going to help this 19-year-old in Tennessee. To bring some tears to my eyes. She told her doc about Crowd Health and like this whole story, and the doc is like, I'm signing up. So now we have her doctor on Crowd Health, right? Which is like such a cool thing. And so I'm like, man, that's how healthcare should be, you know? Like we actually should know like who we're helping. And I don't say it's whatever her name is or whatever in Tennessee, which is like a 19-year-old in Tennessee, but like we as humans can be like, man, like I want to help that other human who's going through a really hard thing, and the insurance company like wedges themselves in between us and our neighbors, and so we can't do that anymore, right? Like hundreds of years ago, if our neighbor got hurt, right, we'd go and like plow their field for them because they can't plow their field, and if they can't plow their field, they're not going to be able to help their families, right? And so it's like that's what sucks about health insurance is like it it sucks the humanity out of healthcare, and that's why I'm doing this. It's just like we got to get that back, and let's take a swing at it. It's a David versus Goliath kind of deal, but it's one of those where it's like let's somebody's got to take a swing at this.
I think there's an innate desire to give, to want to help, and we've created systems that prevent that. And clearly, what you're doing at Crowd Health is incentivizing that, is showing that there is still humanity left in what is arguably, it's not arguably, it's been a very challenging few years, and to see people wanting to give in the manner that they have through Crowd Health is inspiring. I think what you're doing is inspiring. And as I said at the beginning of the show, I don't get excited about startups, health startups very often, but I'm proud of you guys. I'm proud of what you're doing. I'm proud of your mission. And I can't wait to see where it goes. And I look forward to becoming a member in due time.
Oh, we'd love for you to join us. And again, thanks for taking the time. And so sorry about some of my long-winded answers, but you can kind of tell them this is my passion, is to help folks. And like I said, we're going to take a swing at this. And there's big health insurance companies and regulators and all kinds of people who actually want us to fail. So we'll see how we do. But it's been a fun thing to see. And we've got thousands of people to agree to join us, and we've got a little bit of scale now, which is making things easier, and our processes are getting better and things like that. So it's been a fun journey.
My last question, one that I ask every guest, is what gives you hope, Andy?
Yeah, I mean, it's it's I think it's the example that I gave you, right? That like in this time of turmoil, I mean, we're just literally right off. I don't know when this airs, but like last night was when we got results on our last political election. It's like it's so dividing in our country, and it's just like, man, like if we can do something where it doesn't matter if you're a Republican, a Democrat, a Libertarian, or socialist, or whatever, like can we find some humanity in people who need our help, right? Like, can we find a humanity in somebody who is a woman from Tennessee who just got her fingers chopped off and needs help, right? Like, that's hope, I feel like if we can reinstill that into our country and look at people who just like have normal day-to-day problems, and sometimes not normal day-to-day problems, like getting their fingers chopped off, as opposed to an R, a D, an I, a L, a whatever, right? Like, man, I think there's hope there. So, can we through, healthcare kind of bring people together to say, hey, I don't care who you are or who you voted for. If you're going through a really hard time, I'm willing to step up and help. Like that to me gives hope. And maybe I'm totally naive, but you know, um, naive people do crazy things that sometimes work. So, so let's go for it. And so, anybody who's listening and wants to kind of join in that, like, again, it's kind of a missional thing for us, and we'd love for you to join up. And like I said, this is not about making zeros for me. This is really being like, I want to change healthcare so our kids and our grandkids, not to be cliche, like have something that's like, I do believe we have the best doctors and the best technology on the planet. It's just like, how do we access them in a way that doesn't matter if you're a millionaire or making $12 an hour, but you can access, really great healthcare. Like that's my hope.
Love it. Thank you so much for your candor. Thank you so much for everything you shared with us today. Please tell the listeners where they can find you and Crowd Health.
Yeah, I'm on all the social platforms. Twitter is Join Crowd Health. We put some, kind of fun. We have a little bit more of a fun approach to our social media. It won't be your typical, boring corporate social media platform. So, same thing on Instagram and TikTok and Facebook. Join Crowd Health. I'm Schoonover Andy on all of those platforms, so you can find me there. And then joincrowdhealth.com is our website. If you use the code Bitcoin, you'll be in our Bitcoin community, and it's $99 a month for 6 months, the first 6 months. So it's a great deal. And you'll be a part of a great crew of people too.
Fantastic. Thank you so much. I really appreciate it.
Thanks, Mark.
Thank you so much for tuning in to The Progressive Bitcoiner. If you enjoyed the show, head on over to Apple Podcasts and please leave a review. And don't forget, we have a website, theprogressivebitcoiner.com, where we have a lot of great content on Bitcoin and progressive issues. Thanks again for tuning in.